Hi, I'm Matt Clark, the MD of Tour to Cure, and thanks for joining us for the latest episode in our series, Cancer Doesn't Sleep and Neither Do We. And today we're going to be talking about prostate cancer, and I'm delighted to be joined by the CEO of the Prostate Cancer Foundation of Australia, Professor Jeff Dunn. Welcome, Jeff. And
Thank
also
you.
by Sally Sara, who's the Director of the Nursing Program run by the PCFA. Thanks so much both for your time.
Pleasure to be here.
Great. It's great to have you here, Jeff. Jeff, we've all heard about the prostate. What is it and what's its role in men's health?
Well, it's an important question, isn't it? And, we recently did a community survey asking, members of the public about prostate cancer, and there is still a level of uncertainty about that. And that's a job we need to address. The prostate gland is important in our reproductive system. It provides seminal fluid, which is important for reproduction. It's a gland about the size of a walnut. It wraps around some of our genitoureteral plumbing, so around our urethra and other things, which is why sometimes it can be involved in issues surrounding, passing of urine and those types of things. What happens with prostate cancer, with the prostate gland in men, is as they get older, the prostate gland changes. And occasionally, these changes can bring around a swelling of the prostate gland, and in other occasions, it can actually lead to prostate cancer, which is the single most common cancer diagnosed in men in this country, and hence why it's such an important issue for us to get messages out there.
Right, and what are the symptoms of prostate cancer then? How will men know or be able to tell if they have them?
Well, I think from a symptoms point of view, what I might do is throw to Sally in a little while, who's more experienced with those symptoms and manage them. But can I say just up front to anyone watching this webinar that our message is clear about prostate cancer. If you're a man over 50 in this country, you really should talk to your general practitioner about prostate health and have a discussion with your practitioner. If you're a man with a strong family history of prostate cancer, you really should have that discussion with your general practitioner from the age of 40, because there is a link between family history and prostate cancer. It does not mean that if you have someone in your family that has had prostate cancer, you will get it. But from a risk factor point of view, there is a link. So it's important, if you've got a family history, to talk about prostate health to your general practitioner from the age of 40.
And Jeff, we'll come back to Sally for the symptoms in a second, but I know that the question of checks has been a controversial subject for a long time. Through personal experience, I know that. And why is it so controversial and why is it contentious? Because there are checks, but there have been times when they haven't been recommended. Why is it contentious?
Well, look, Matt, that's a very good question, and let's look at it. I mean, at the moment, the test that we have is called the PSA test, prostate-specific antigen test, and it is an indicator. So what it detects, the PSA test, it detects changes in levels of certain chemicals in our bloodstream, certain markers. And they may indicate a prostate cancer and they may not. It's not a diagnosis, it's an indicator. So when you get a PSA test, it's important then that you talk to a medical practitioner who can make a diagnosis. What we're a bit concerned about is in previous times, earlier years, PSA testing was used as a diagnosis and more men were getting treated because there was more PSA testing, and perhaps some of the testing led to some treatment which wasn't necessary, and that's made it a little controversial in the past. But there have been developments and changes. There are new radiological techniques which take some of the uncertainty out of these things, which is why we say that it is a test and it's an indicator. So if you're 50 and above, talk to your general practitioner about the risks and benefits of this test. Try and understand what it means and understand what it does, and then make an informed choice about what to do. And once again, if you're 40 and above and you have a family history, you should check your general practitioner. But Matt, if I might, I mean, just talking, because Tour to Cure has been such a fantastic supporter of Prostate Cancer Foundation of Australia and our research over many years, and it's committed to support one of our new research grants, which is in epigenetics, which is a study of, detailed genetic aspects of a human makeup. But this one particularly about prostate cancer and trying to determine which prostate cancers, if you detect them, are aggressive and which aren't. And this is particularly important because if you detect a prostate cancer, they're not all the same. And at the moment, we find it difficult to be able to tell which ones are aggressive and need to be treated early and quickly, and then which ones are other ones which may not need to be treated so quickly, which means you can sit and there's a thing called watchful waiting, and you can actually just watch that disease, that early stage, and make a better decision about how to treat that down the track. And some of that work, Tour to Cure is now partnered with us on, and we're really excited about what that might mean about early detection and then appropriate treatment for prostate cancer.
Fantastic, Jeb. Yeah, thank you. That we might come back to that. I think that's called the therapy trial, if I'm right. But we did mention we came tantalisingly close to introducing Sally into the conversation before, and we were going to talk about symptoms of prostate cancer. Now, Sally, come on in. You're in Adelaide. Looks like a gorgeous day out there. What are the symptoms? How will men know or suspect that they might have prostate cancer?
Well, for localised prostate cancer, so prostate cancer that's well contained within the prostate itself, there's quite often no symptoms at all, which is why some men, when they're diagnosed with prostate cancer, just are so shocked because they can't quite believe that it's there. And for men with localised disease, quite often it's they get some symptoms from benign enlargement, so age-related enlargement of the prostate, like Jeff was talking about, and that causes some issues with their waterworks. And they go off and have that looked at, and as part of the workup, they have a PSA test, and that shows that there's a problem and one thing leads to another. But quite often with localised disease, there are no symptoms at all. For advanced disease, so when the prostate cancer is broken outside the prostate itself and started to spread elsewhere in the body, that's often when the symptoms pop up. So men will present to their GP with back pain, commonly back pain or hip pain, leg pain. They'll feel they've strained themselves playing a game of tennis and it hasn't settled down or something like that. And the GP will send them off to have some scans done, and then the first sign will be that some bone cancer, so secondary bone cancer shows up. So most commonly when there are symptoms of prostate cancer, it's when the disease has become more advanced. And certainly in the more advanced stages, you can get some issues with trying to empty your bladders or having trouble emptying your bladder, sometimes blood in urine, blood in semen. In fact, blood in urine should always be checked anyway. It can be a sign of other neurological cancers like kidney cancer and bladder cancer. So anytime anybody has blood showing in the urine, they should get that checked. But that's one of the problems with prostate cancer, is that in localised disease, which is more the common state, that there are often no symptoms at all. Yes.
And what is the survival rate for prostate cancer patients, and what are the treatment options for people if they do have prostate cancer?
So the survival rates are excellent. The 5-year survival rate for prostate cancer is 95%. And interestingly, in 1987, the 5-year survival rate was 60%. So I started my nursing career in 1987. So I can sit back and say in my career, 5-year survival rates have gone from 60 to 95%, which is an incredible shift when you think about it in that 30-odd year period. So treatment options tend to be broken down into whether the prostate cancer is localised or contained, where the focus on treatment is the intention of curing or completely getting rid of that prostate cancer, to treatment options for men with more advanced disease where it's spread outside the prostate, and the focus then is on long-term control as opposed to cure. So for men with localised disease, quite often have more than one option available to them, which is a great thing in the cancer setting. It does, however, cause significant stress for many, many men who have to decide which treatment option to take. For men with low grade, so slow growing and just a small amount of prostate cancer, often have an option to do a protocol or a surveillance protocol. We call it active surveillance. So it's watching, regularly having blood tests, checkups, repeated MRI prostate scans, repeated biopsies, but it's sort of delaying treatment and then instigating active treatment if the situation changes. And for those that have a little bit more disease, but still in the localised setting, surgery, so surgical removal of the prostate gland itself, or radiation therapy. There's a couple of different radiation therapy options, external beam and brachytherapy, and all of those options are intended for localised disease to get rid of the cancer. For men who are in a situation who have more advanced disease where long-term control is the focus, treatment tends to be delivered then through hormone manipulation or hormone deprivation, we call it. So using medications to stop the body producing testosterone, chemotherapy options, and there's some new emerging options for really advanced metastatic disease that are looking quite exciting and have popped up in the last couple of years. And certainly one of those is we're seeing through the therapy trial, which you've been very generously connected to, and that's showing really promising signs of sort of further options for men with really advanced disease.
Thanks. So lots of options there. And my understanding is it's the surgical option is the one that causes a lot of grief and contention about treatment. We might come back and talk about that a little bit later when we talk a bit about the nursing program and how you help. I just first wanted to ask Jeff, the numbers of men with prostate cancer, I understand it's already large. Can you just tell us about those numbers a bit? But I also understand it's about to get a lot bigger.
Well, so we estimate that in Australia today, there are 211,000 men who have been diagnosed with prostate cancer and are living with that disease. Now, each year in Australia, there's around 17,000 to 18,000 new diagnoses made each year. And each year in Australia, there are around 3,000 men die from this disease. What we know is, notwithstanding family history, the single biggest risk factor for developing prostate cancer is age. So still, the older you get, the more likely you are that you might be diagnosed with prostate cancer, so your risk goes up. So we have an aging population, and there are more of us. So there are more Australians, and there are more of us living longer lives. So as a direct consequence of that, there are more men being diagnosed with prostate cancer when you look at absolute numbers. So the numbers of men being diagnosed at this point in time is on the increase. What's also important to note is, as Sally pointed out, and you quite likely raised the questions about survival rates. So because our survival rates in Australia are amongst the world's best, 95, 96%. We want it to be 100%, by the way, Matt, to everyone out there. Working at it.
Don't we, Jeff? We're on your team.
We're working on it, but at the moment it's 90, 95, 96%. What that means is, because there are more men being diagnosed with this disease, and there are more men being successfully treated and living longer. They're being detected earlier. Their treatments are much, they're better. With the technologies have changed. The advances have been fantastic. So there are more men diagnosed, more men getting treated, and more men living longer with this disease. The numbers of men out there with this, but with living with prostate cancer, it's just going to increase. That's just the way it's going to be. And importantly, we do know, notwithstanding the quality of the treatments and the expert care they get from our doctors and nurses and health professionals, occasionally there are some side effects to treatment, and you've alluded to that, Matt. And I think what's important for us is it's on three levels. We need to work out how we can detect this thing as soon as possible so people get the best chance at treatment. Then we need to focus on how do we have the world's best treatments here? What's the groundbreaking things that we can do to make sure the treatment is successful? And the third part of what's critical for us at this point in time is it's not just about living longer after a diagnosis of prostate cancer, but living well after a diagnosis. So how do we help men and their partners and their families, deal with potential consequences of physical side effects, psychosexual side effects, social impacts, changes to their work and family life, to their networks, how they go about their business. All of those things are critical for us, and in a combined way, they are the reasons that we all turn up each day at PCFA to try and address these questions.
That absolutely, Jeff. And Jeff, I think that feels like a really nice segue to bring Sally back in, because the prostate nurse program that you run is a really important program to help people who are going through the prostate cancer journey. Can you tell us a bit about how the prostate cancer nurses help in the journey?
So we support 54 nurses now in every state and territory in Australia. And the prostate cancer specialist nurses, our goal is that they link in at diagnosis wherever possible. So they're right at the beginning, meeting the man and family if there's family around, and their early involvement really is helping the man come to terms with what's happening, what the diagnosis means. Often after a diagnosis, there's some more tests that need to be done. So helping navigate through the health system, which, as you know, the Australian health system is quite complex, and really helping men come to a decision as to which treatment option to take. For many, many men with localised disease, they are offered surgery or radiation therapy, both equally acceptable, gold standard treatments. They're just delivered in a different way, and the side effect profiles are a bit different. And for men to decide which avenue to take is incredibly challenging. So the nurses have a really important role at the beginning. Once the treatment decision's made, they coordinate the care really into whichever treatment pathway is being chosen. And then there are many nurses and doctors around Australia who are employed to deliver that care. So whether it's surgery or radiation therapy or whichever option they take. But when the treatment's done, often the acute care services, after a period of time, start to step away because our system is busy. We're working in an incredibly busy health system. So the second really important part of the prostate cancer specialist nursing role is to be there for the longer term. So to link back in after treatment and be involved really for living well, survivorship care, a very strong focus on side effect management, and an equal emphasis on good physical health and good psychological health. So they play a very important role after treatment as well as beforehand. Yes.
And psychological health for men who've been through prostate cancer, potentially surgery and other treatments, that can be, there's a need there, isn't there? A significant need in the population for your help in that regard.
There is. The side effect profile for prostate cancer is quite debilitating, and sadly the side effects are not often spoken about in the community. Often the side effects are quite personal and men are embarrassed by them, but they really do have an impact both physically and psychologically. And we know that 1 in 5 men really with prostate cancer will deal with anxiety, depression issues. We also know that men diagnosed with prostate cancer are at 70% greater risk of suicide, particularly in the first 12 months post-diagnosis. And it's not easy for a man to ask for help. Sometimes it's not easy to even recognise that psychologically they're not tracking all that well. So it's a really critical part of the nursing program role that we're linking in early, and we're regularly checking in or screening for distress, and that we are then following up with support and interventions that address the issues that are going on for that man. And they are quite often, as I said, physical and psychological issues. It's a very important part. And as Jeff said, men live a long time with prostate cancer, and for many men, they live a normal length of life, but they don't always live well. And that impacts on their family, their partners and their families as well. So it is a very major part of our nursing program that we're locked in trying to make sure that men receive psychological support as much as they receive physical support for physical side effects.
And how many men can access the nursing help? And where? Is it Australia-wide?
It is Australia-wide, so we do have nurses both in metropolitan and regional centres across all Australian states and in Northern Territory and ACT. We've currently got 54 nurses. We've got another 25 coming in the next 6 months. And again, the split is around about 50% regional and metropolitan. They're based in fairly large treatment centres. And our reach at the moment is around about 1 in 3 newly diagnosed men. As we bring the next 25 on, that will, our reach will broaden. But we know that there will always be gaps. There will always be men in areas where they can't access a nurse face-to-face in a treatment centre. And for some men who are newly diagnosed, they're not sure which treatment option they'll take yet. So they may not, the nurse may be in a surgical centre and they don't know they're going down that path yet. So we know that there is still a significant gap in terms of men and partners accessing prostate cancer specialist nursing care. So this year we're very excited. We're working towards setting up a tele nursing service as well. Our aim is for that to be in place in the new year, where we'll have specialist nurses available by phone. So anyone, anywhere in Australia, a community member, a partner, a mate, a man dealing with side effects can pick up the phone and ring and speak to a nurse who actually has experience in terms of prostate cancer care, and get some support there. So that's our next step in terms of plugging the gaps, because in reality, to place a prostate cancer specialist nurse, it is a specialist role in every single medical centre in Australia, would be a big ask. So we've done extremely. We started in 2012 with a pilot with 12 nurses. So we've gone from 12 nurses in 2012 to 54, and we are aiming, we'll be at about 80 or 90 by the end of next year. So we've had phenomenal growth, but we are absolutely committed to putting in the telenursing service as well, so that no man misses out across the country.
Well, congratulations on the expansion. It's fantastic, and thank you so much for the great service you provide for so many people who desperately need it. With the tele service you're talking about, the telehealth service, is that something that's been on the radar for a while, or has coronavirus and the new world we live in brought that on? And also, how has coronavirus impacted your ability to provide your standard services to people?
The need has been there for a little while. We've certainly been aware of it, but with, like all services you develop, it takes time and finances and to put everything together. So it's been a dream really for the last probably 18 months to get this up and running. There's no doubt that the coronavirus has highlighted further to us that there are those gaps in accessing support, and we have a 1-800 number for PCFA, and we've noticed since April we've had quite an increase in callers and emails coming through our inquiries line looking for support, and they've been forwarded on to myself and my team. In terms of our nurses out around the country and dealing with the situation with COVID-19, they have remained, as they always remain, absolutely committed to continuing to provide a service. There's no doubt that in states like Victoria, that's posed some challenges, and really the providers of the health service, the doctors, the nurses, the allied health teams have had to find different ways to deliver their care. And there's been a shift from face-to-face consultations to telehealth based, so either telehealth video camera type or just by telephone. And that poses challenges too, particularly in regional areas with technology and access. But I'm so immensely proud of them all in the way that they have continued on and are just strive every day to provide the best quality care they can given the circumstances they're working in.
Yes.
We track our activity. We've seen probably since April a 20% increase in telephone contacts that we have across our service Australia-wide, and a corresponding decrease obviously in face-to-face consults. But they've become very creative, and full credit to everyone in the community, our nurses and also the men they care for, in terms of how they've embraced changing and using new technologies, and keeping the contacts going. So yes, there have been challenges, but full credit to all of them. They've risen above and beyond those challenges to continue to deliver their service.
Sounds like a great team, Sally, and Jeff, you must be proud as well.
100%. I mean, this is a terrific team of people. I mean, they do fantastic work day in, day out, and we are so excited at the opportunity to expand that to, 80 to 90 nurses by the end of the year. Makes such a difference in men's lives and their partners' lives and their families' lives. And then, of course, as Sally's mentioned, Matt, the whole notion of a telephone-based service to ensure that no matter where you live in Australia, you can pick up a phone and talk to someone who's knowledgeable and empathic, understands what you're going through, and can help point you in the right direction, with some warmth and care. And that's what we're going to put in place as soon as possible. And of course, you mentioned COVID. If I could segue, Sally spoke about the nurses have done a fantastic job in the face of COVID. And another issue we've had in relation to that is a reluctance, and Sal touched on it, for everyone in the community, not just men, but, attending medical appointments, staying away from hospitals, avoiding tests. And, our message out there to all Australians, but from a PCFA perspective to fellows out there, if you're 50 and above, talk to your GP about a screen, about a PSA test. And if you're under active surveillance and you're due for a test, make sure you turn up. I mean, people are, for all the right reasons, and we understand that our community's different now, and we don't move around the way we did. We don't interact the way we were. We're more careful about certain behaviours. But year on year, the Pathology Awareness Australia tell us that there's been a year-on-year corresponding period, a 60% reduction in PSA testing. Now that concerns us, because what we're not trying to do is get over-testing and get people over-treated. But what concerns us is that we're going to get this pent-up disease burden, and then when things start to return back to normal, well, we'll find all this disease we didn't find before, whether it's prostate cancer or anything else. And sadly, some of it might be at a later stage than it would have been. And then that impacts on our ability to treat that disease as successfully as otherwise might have been the case.
It's vitally important, isn't it, Jeff, that if you have an inkling that you've got prostate cancer, that you do something about it very quickly, because getting in early increases your chances dramatically.
So true.
And we talked about therapy, which is a program that Tour de Cure is funding with the Prostate Cancer Foundation of Australia. Can you give our viewers a little bit of an insight into what it's about and how it's going to tackle cancer? Yeah,
sure. So therapy, THERAP, that's its snappy marketing name, isn't it? Therapy. And I tell you, it worked pretty well, by the way. Everyone remembers therapy. Look, it's a fantastic program. PCFA has invested $1.5 million in that research, and your supporters, Tour de Cure, and thank you for this, have contributed $500,000. It couldn't have happened without you. So please understand that you have made a difference. And therapy was a clinical trial, so it compared a standard sort of chemotherapy. The details don't really matter, with a new sort of radioactive therapeutic treatment. It combined a new means of scanning, PSMA, PET scanning, which is a radiology technique, with a particular radioactive molecule. And the radioactive molecule is injected into our bloodstream. This particular molecule, lutetium, has an affinity for cells that tend to accumulate, for a protein that tends to accumulate on the outside on the outside of our prostate gland, particularly if there's cancer present. So if there's a prostate cancer present, this particular molecule really does enjoy binding with it. And if you attach it to a radioactive molecule like lutetium, it takes the radiation therapy direct to the molecule, and it takes the radiation therapy direct to the cancer. I mean, it's like Star Wars in a way, isn't it? I mean, it's just such, I mean, it's such a novel therapy. And we've done it here in Australia. PCFA has been funding it. Our researchers have conducted the trial. It was over 200 cancer patients, prostate cancer patients in 10 settings. The results are in. I have to say to you, preliminary results have been presented at international urology meetings late last year and early this year before the pandemic hit in Australia and abroad. And what we're waiting for now to acclaim, because it really does speak to a whole new class of therapies to treat prostate cancer, and importantly, advanced disease as well. I mean, it holds out great hope. What we're waiting for now is for it to be published in the academic literature. There is a process, as you know. So the papers are being now reviewed by eminent scientists and clinicians and neurologists around the world, and we're waiting for that day in the very near future, Matt, and we'll make sure we send you a copy when it gets published. We're waiting for that day when that appears in the Lancet or in the BJUI or wherever it is, and we start to turn this thing into standard practice. That's when we can start to make a difference.
And we're really looking forward to that. You're obviously very excited. How big is this for punters out there, people like me who aren't medical researchers? What does it mean? What do you think it means?
It's a game changer.
It is.
I mean, this is just fantastic. It's a whole new class of therapies. And it's something that, you know, we didn't have 5 years ago. And it's also setting us up for what's into the future. It gives our researchers and our clinicians, you know, hope. These are the sorts of things, if you reach out and grab for these. And that's where, you know, sometimes you think, oh, you know, is it worth investing in this sort of research or stuff? Well, yes, you bet it is. And, you know, your members, your supporters, you know, Tour de Cure have really made a difference. So we're expecting that once we get these clinical trials published, and remember this work, you know, it was led in Australia. It's our people. Fantastic. It'll be a difference.
Something to be very proud about, isn't it, Jeff, for all of us? And thank you for the great work you guys do. Now, in your CV, you've got a rather illustrious CV. I feel like a terrible underachiever. You're an Order of Australia for your services to the medical community. And you're also on the board of the Union for International Cancer Control. What is its role in cancer worldwide?
Okay, so the Union for International Cancer Control, that's, you know, UICC, of course, we call that, it's the global peak body for cancer control organizations. So there's 1,000 members around the world. Prostate Cancer Foundation is a member. It's been around since 1910. You know, I think if we were to think about cancer generally and prostate cancer specifically, the answers to cancer control are collaboration and sharing globally. You know, so for example, we were just talking about this wonderful PSMA lutetium trial, you know, therapy. Those results are going worldwide, and that'll change practice worldwide. But at the same time, there's very important and clever work happening around the world. The UICC is a platform, a network, a community of organizations who are committed to controlling cancer through collaboration, through working together, to sharing the benefits and making sure wherever possible, you know, we make sure that we all share equally in the benefits, to try and reduce disparities because of geography or socio-demographics or technology, and make sure that the world is a better place, a place free from cancer. And that's certainly the mission. And it's my pleasure to serve on the board of that organization. I've been involved for many years, and to know that our work at the PCFA gets pushed into that organization and disseminated globally, and then we can actually start to funnel back through their lessons and all sorts of things from other places as well. So it's a privilege to be involved.
And we're so delighted and proud to be part of that mission as well, Jeff, with you on that. Where are we? you've worked around cancer for a long time. Where are we in the cancer space? When are we going to say we've got this thing under control? How far away is that day, do you think? I've heard various researchers make various claims that this might be the last generation to die from cancer. Where do you think we are?
Well, I mean, you know, I've heard people talk about, you know, breast cancer. When are we ever going to get a cure for breast cancer? Well, for many early stage breast cancers, survival rates are terrific. I mean, if you think about where we are now, Sally mentioned a bit earlier that, well, she's a young thing. She only talk about mid-90s. But when I started working in, you know, cancer control, you know, the 5-year survival rates for prostate cancer, you know, they were in the 50s, you know, and now they're 95%. You know, we could take great encouragement from that. I think it's also important, I think, Matt, to understand that cancer generally is not just, you know, cancer's not one disease. So, for example, there are some cancers where, you know, we have a pretty good idea what the cause is, you know, or what a significant cause is. You know, I mean, not all lung cancer, but much of our lung cancer burden is, you know, related to tobacco smoking. There's some that isn't, that's for sure. Not all melanoma, but we know a lot of our melanoma is associated with overexposure to ultraviolet radiation. So in those cancers, you know, we've had a head start about how we might get about stuff, and there's been improvements. There's still a lot of work to do. You know, the treatment for things like testicular cancer. If you're a young man and you get cancer, if you're a man under 40 and you get cancer, it's more than likely going to be testicular cancer. It's the most common in young men at that age. But if you detect it early, the treatment for testicular cancer, the success rates are just fantastic. So I think what we need to look at is cancer as a cluster of diseases, not one. And our progress in some has been stellar, and we've got terrific reason for optimism. And sadly, there are still some cancers where there's a way to go. You know, they're classified as, you know, cancers with a poorer prognosis. And there are some cancers which are just stubborn, and we're finding it hard. We don't know how to detect them early, really. And there are some that by the time we can find them, they progress to the stage where, well, sadly, you know, treatments aren't as effective as they might have been otherwise. So it's a field, and it's all moving. But I have to say to you, I wish I could say to you out there now, there's one magic bullet and we're going to fix this thing. You know, we're going to get a cure for all of them. But what it's going to be is that perseverance, you know, that faith in our ability to make change over time, and we grasp each little step, and we make the most of it, and we move on. And we've made some great progress in prostate cancer. There's still a long way to go, and in cancer generally, we've made great progress, and there's sadly for some cancers still a long way to go.
Very true, Jeff. Thank you so much for your time this afternoon. Thank you for joining us. And thank you for all the great work that you do on behalf of everyone at Tour to Cure and men in general, of course. Sally, thank you too very much for the nursing program. I think that face-to-face and your telehealth expansion in the new year is going to be wonderful. I know it makes a huge difference to so many people. So thank you so much for that kindness and for the great work that you do, to both of you. And to everyone watching, thank you so much for joining us. We'll be back in the not too distant future with another episode of Cancer Never Sleeps. So please stay tuned. Please check in. We'll be in touch when we've got another episode coming up. Thanks for your time today, and let's stay united. Let's collaborate, Jeff, in this mission to find cures for the many cancers that are out there. Thank you so much.